got to UCLA 22 years ago to do my training in psychiatry and child psychiatry and addiction psychiatry. About 5 years ago, I described myself as the happiest guy in the world. I was a half-time child psychiatrist seeing patients with autism and attention deficit disorder, schizophrenia, had a particular expertise in teenagers with drug addiction, and I was a half-time administrator. I was running our psychiatric hospital, which is a 75-bed hospital. According to U.S. News and World Report, is ranked as the best in the West, but it was where I grew up. I had done my residency. There were 400 people on staff. We had a budget of about $40 million, and I was really in a groove. The guy in my role left to go to Texas, and we had these failed moves from our old hospital to our new hospital that were over budget and delayed. And the dean came to me and he said, "I'd like you to run the UCLA Health System. Because we don't have time to go out and to get a guy who's really qualified. Because we're doing this move. So we'll put you in that role. You execute the move, and then we'll do a national search and get a real person." So with that vote of confidence, I looked around and I realized that I owned one gray suit and had about 2 or 3 neckties. And you didn't really have to dress up as a child psychiatrist, but you did in this new role. So I called my dad and said, "You got to FedEx me some ties right away." And my mom went to Cabazon on her way in from Palm Desert and bought me some new suits. So I looked really good. And I went into this new role. And now I went from a budget of $40 million to now I'm responsible for a $2.2 billion enterprise with 25,000 employees. We take care of 1.5 million patients a year. We get 5 patients per day by helicopter. We do more organ transplants than any hospital in the United States. Just did our first limb transplant, or evaluating patients for a face transplant, abdominal wall transplant. We invented the PET scan. We invented Herceptin, which is the first personalized treatment for breast cancer. We diagnosed the first case of AIDS. We got Nobel Prize winners on the staff, and I have absolutely no idea what I'm doing. The first day on the job, they come up to me literally and say, "How many bunkers should we put in the MOB?" I don't know what a bunker is, and I don't know what an MOB is. So I did what I still do every day, and what I think I'm best at, and that's walking the halls, going into patient rooms, knocking on the door, sitting down on the bed, and saying, "How's the care? And is there anything I can do to assist you with your care?" And I did that for about 2 to 3 hours a day for the first 100 days, every single day, weekends included. And I'm a slow learner, and after those first 3 months, I learned 2 things. I learned that UCLA performs miracles where others can't. We do very cool stuff. We can take a liver, chop it in pieces, give it to different people that are in liver failure, and they go back to their community and playing soccer and working these incredible miracles. And I also learned that the place was dirty. No one knew who was in charge of their care. We had air conditioners that didn't work. I met patients who couldn't get bedpans when they needed them. We were short on wheelchairs. And if you asked our patients, would you refer us to a friend, or rate us on a scale of 1 to 10, our hospitals, we were in the 38th percentile. 2 out of 3 people would not refer UCLA to a friend despite our saving their lives, because we didn't come across as particularly compassionate. For those of you that are on the west side, if you think back 4 or 5 years ago, if you got sick, you went to Cedars or St. John's. And you went there because you'd get better care, it was more coordinated, people understood you, they were excited to see you. And you went to UCLA if your doctor said, "You've got this very unusual thing and you need this knuckle transplanted into your back," or something like that. We have some expert that can do that, and you put up with UCLA. I'm not sure what our purpose or our mission statement was 4 or 5 years ago when I took on this role. But it should have been something like, "Aren't you lucky you get to see us?" Because that's how we came across. So I said to groups like this and to everyone at UCLA after about 3 months, I've come up with what we're going to do. We're going to be more patient-centered. We're going to focus on that next patient as if it's our most important patient. And audiences looked at me, probably a third of them looked at, some of them said this to me, you're crazy, why did we hire the psychiatrist, why can't we get a real guy in here, this will never happen, we'll never be like Cedars and St. John's, you know, we have residents, the list and list, we're a state institution. By the way, if you go back in that time, we just borrowed $75 million to make payroll, so we weren't in what you call very strong, borrowed from the Chancellor, in very strong financial shape. And I said, I don't want to hear any more about how many patients are in beds, I don't want to hear about their payer mix, I don't want any more Excel spreadsheets. I want to hear stories about how we care for patients. And I just met a patient upstairs, and here's the problem, and we need to fix that today. Because you want me to do this in 20 minutes, I won't go into all the details, but I'll give you the bottom line is now there's 6,000 hospitals in the United States. They all get asked the same questions when a patient gets discharged. Would you refer us to a friend? Would you rate us on a scale of 1 to 10? We're now rated in the 99th percentile among 6,000 hospitals. There is no academic medical center in the United States that is rated higher than us. They wrote books about us. There's this incredible sense around what we're doing to connect with our patients. It has completely changed the business model. St. John's has empty beds. Cedars has empty beds. We run at 110% capacity and are turning away approximately 200 patients every day that want to come to us for care. This is a business group. It's a pretty simple lesson. If you take good care of people, they go out and tell their friends, and it's great for you. So let's